I'm Jennifer Stevens, Principal Researcher at America's Essential Hospitals. I want to take a moment to say thank you. It's two small words that we cannot say enough to each and every individual who works within your hospital. We want to say thank you for your commitment to your patients and your communities during this grave pandemic. For myself and all of us at America's Essential Hospitals, it has been an honor for us to bring you COVID-19 webinars. We've covered topics including the CARES Act, non-federal resources to support our hospitals, issues around operating during COVID-19, and social determinants of health, for example, homelessness and food insecurity. We've also talked about provider well-being and burnout. If you've missed any of these topics, as well as others I haven't mentioned, please feel free to go to our website, essentialhospitals.org. Click on the Education tab at the top, and members will have access to all of our webinars, materials, and recordings. Today, we thought it would be good to do a COVID-19 check-in. We have 4 expert speakers from within our association who will talk to us about equity, racism, leadership, legislation, advocacy, and dissemination of best practices. There's far more information that we could squeeze into this quick recording. And so we hope you'll join us for a much broader discussion during our Virtual VITAL 2020. This year, VITAL will be online, August 11th to 13th, and again, August 18th to 20th. You can join us live for sessions or on demand for the next year. Simply register at a 70% discount at vital.essentialhospitals.org.
Our first speaker today is President and CEO of America's Essential Hospitals, Dr. Bruce Siegel. Bruce, thank you so much for joining us.
Great to be here.
I am going to jump in with our first question, and it's a very serious one. The murders of unarmed Black men and women, including George Floyd, Ahmaud Arbery, and Breonna Taylor, as well as excess COVID-19 infections and deaths, have shown a bright light at that, on the disparities amongst racial and ethnic groups across the country. What has the association done to heighten their work in this area?
And issues of equity and of social justice have always been very much an integral part of America's Essential Hospitals. If you look at our mission and vision statement, they talk about things like excellence in healthcare for all. They talk about equity for all populations, regardless of social circumstance or economic circumstance. So this is not necessarily new to us, but what's happened in the last few months has really given us an opportunity to hold the mirror up to ourselves. And I think our members are doing that as well, and understand what we are really doing to confront structural racism and social injustice that is at the root of some of these issues impacting people of color. So recently, our board of directors announced that we're launching a multi-pronged initiative to look at our own governance structure and see if it reflects our membership and the communities they serve. We're going to also be looking at how we can better support our health system members in the work that many have already started, frankly, around becoming anti-racist organizations, around really taking on these issues and confronting them. And some are definitely leaders there. And even ourselves as an organization, as an employer, as a procurer of services and goods, we're going to be looking at whether we're doing that in an equitable, forward-thinking fashion. I mean, the other thing we need to do is also look at how or where is our voice being heard and what are we saying. So advocacy is very important to us. Are we advocating to combat racism? Are we linking racism to the public health crisis going on now? Racism can be seen as a public health crisis in and of itself. So it's a tough circumstance, tough times, but I think we have literally perhaps a once in a lifetime or once in a century opportunity to actually deal with these issues and actually try to fix them rather than just talking about them.
Thank you, Bruce. It's hard to go even an hour, I would say, without hearing folks talk about what unprecedented times we're facing or working to create a new normal. In such unprecedented times and times of uncertainty and change, how are leaders of essential hospitals working to support their staff and their communities?
Our leaders are hopefully doing this with humility, and I know that many are. I think that's key to leadership. I think they're asking themselves some tough questions. Who leads our organization, whether that's in the executive suite or on the board, and does that look like the community we serve, and is that a diverse group that will make better decisions? Because we know that diverse groups do make better decisions for a whole host of reasons. They're also asking themselves, do we have the trust of the community? Our essential hospitals do seem to have greater trust than hospitals overall, but it's still a question our leaders need to ask. And if they don't have that trust, how do they go about either getting it or getting it back? I think, given what we've seen over the last, 4 or 5 months of this pandemic, they also have to think and ask themselves, are we caring for the caregivers? Burnout is real among nurses, among physicians, among the entire spectrum of health professionals. And I'm not sure there's been any time in our history where that stress has been greater. We have health systems in our membership who have had literally dozens of their staff themselves fall ill in the pandemic from COVID-19. So how do you deal with that? And finally, I think they have to sort of ask explicit questions about disparities and inequity in their own treatment of patients and in their own community. That starts with measuring the outcomes they have for different populations. Some places do that now better than others, but then it also means acting on what they find. And so that's going to be absolutely critical as well. I think this is a unique opportunity for exceptional leadership to really rise to the top. I think it's also going to be a time where we're going to look back and say, what did this teach us about leadership?
Thank you, Bruce, for providing perspective on the issues facing our members.
Thank you.
On Tuesday, August 11th, Zuckerberg San Francisco General and New York City Health and Hospitals will present on achieving health equity through system-wide strategies. I'm also looking forward to the CEO panel, COVID-19 Leadership Lessons, on Thursday, August 20th. That session will feature member CEOs from Henry Ford Health System, New York City Health and Hospitals, Northern Arizona Healthcare, and University of Washington, or UW, Medicine. Up next, Dr. Beth Feldpuss, Senior Vice President, Policy and Advocacy. Beth, there have been so many different funding legislations that come through. For those of us who aren't familiar with all the different policies, can you help outline what funding has targeted essential hospitals?
Congress has passed several different pieces of legislation throughout the spring and early summer that targeted relief funding to healthcare providers. The two largest were the CARES Act, which passed in March 4th, and the Paycheck Protection Program and Healthcare Enhancement Act, which passed in April. Combined, that legislation allocated $175 billion toward provider relief. This funding is to help healthcare providers make up not only the lost revenue that they saw and are seeing during the pandemic, but also to assist them with the increased costs. After Congress designated this funding, it was up to the administration, specifically the Department of Health and Human Services, to allocate it. The money is still being doled out, but here's what HHS has done so far. The first $50 billion that went out the door to providers was done so through a more general distribution. So this $50 billion, I'll just keep adding zeros. And this funding was really designated based on the size of a provider. So hospitals that were larger or hospitals that care for more Medicare patients got more of this general funding allocation. That didn't work as well for essential hospitals who don't have as many Medicare patients or as increased amount of revenue as other hospitals. After the general fund, we worked really hard to make sure that the department targeted the next funding rounds to essential hospitals. So we were really pleased to see that the next funding that went out in a more targeted fashion addressed hospitals that were in hotspots that had a lot of COVID patients. $10 billion went out to those hotspot communities, and an additional $2 billion on top of that $10 billion was designated to help hospitals with high DSH patient percentages, namely essential hospitals, in those hotspot communities. After that, we saw a dedicated funding stream just to safety net hospitals. And this was the particular funding stream that we had worked very hard to get HHS to recognize and sent out the door. This safety net funding tranche, as it's referred to, had $10 billion for essential hospitals. And that was great. We saw about half of our members receive funding through that safety net tranche, and we're very thankful for that. But with only half of our members receiving that money, we knew our work was not done. So we continued to press the administration for additional designated safety net or essential hospital funding. And we were pleased that even more recently, an additional $3 billion went out the door to safety net hospitals. So in total, out of that $175 billion to date, $15 billion has gone just to essential hospitals and our members. And we're pleased to be able to work to give our members that funding relief. I will say, though, we're not done yet. We do know that we have a fair number of hospitals that have not received any of that funding to date. And particularly in those communities that are emerging hotspots, there continues to be great need from hospitals, again, on both the increased costs that they're experiencing and lost revenue. So of the roughly $50 billion left from that CARES Act funding, we are going to continue to press the administration to target our hospitals. And of course, we're going back to Congress to make sure that additional provider relief funding makes its way into any future congressional bills.
Thank you so much, Beth, for sharing with us in such a succinct way. I know there's so much more detail and additional information that you and your team have been providing and will continue to provide to our members. I hope that folks will be able to join us on Wednesday, August 19th to register and listen in live or on demand to hear our own Mary Ellen Guinan present on COVID-19 resources for essential hospitals. In addition, we'll be offering a session on the foundations of essential hospital financing on Tuesday, August 11th. Action alerts from Carlos Jackson, Vice President of Legislative Affairs, remind us of essential hospital relief measures to help our members continue to serve vulnerable populations throughout the pandemic and beyond. Carlos, what are current legislative essential hospital priorities for this upcoming COVID-19 bill?
Thank you, Jennifer. Our work is primarily focused on ensuring the next COVID-19 supplemental legislation includes adequate relief measures for essential hospitals. Now, you've just heard from Beth, who talked about the Provider Relief Fund, which was created by the CARES Act, in which Congress allocated $175 billion towards hospitals and healthcare providers. That's one area where we've been focused, but we've also been working on other policy relief measures that will be beneficial to essential hospitals as our members weather this current public health crisis. So in addition to the Provider Relief Fund, we are also working to protect Medicaid payments for essential hospitals. Of course, our members treat a large number of Medicaid patients relative to other hospital systems, and so we want to protect those reimbursements as much as we can, especially in this current pandemic. So we are asking Congress to once again work on a bipartisan basis and block the upcoming cuts to Medicaid disproportionate share hospital payments, which would take effect on December 1st of this year, absent further action from Congress. In addition to that, we are asking that the lawmakers in Congress to block implementation of the administration's Medicaid Fiscal Accountability Regulation, or MFAR as it is called, since it will lead to cuts to Medicaid supplemental payments that essential hospitals rely on. In addition to this, we are also working with Congress to further extend the flexibilities that have been put in place through earlier COVID-related action in relation to telehealth. We would like Congress to make permanent many of the telehealth flexibilities that have already been put in place to further help our member hospitals deal with the increased volume that they are seeing right now for telehealth visits. On top of this, many essential hospitals applied for Medicare accelerated and or advanced payments to help weather the storm that is COVID-19. These advanced and accelerated payments have significant repayment terms and conditions, including a very high interest rate. So we are asking lawmakers to either forgive the payments that have been made to essential hospitals or significantly relieve the repayment terms. So lower the interest rate and extend out the repayment timeline. We're working very hard on this particular area, and we hope to bear some fruit on this in this next bill that is currently under development. On top of these priorities, we have additional areas that we are working hard on behalf of our member hospitals, including protecting 340B eligibility for essential hospitals during the COVID-19 public health emergency. And we're also working to extend payroll tax credits that have been made available to employers in previous COVID-19 legislation. However, it does not apply to public hospitals. We would like public hospitals to be able to take advantage of these payroll tax credits. So these are a few of the other areas we're active. And as always, we are focused on the disparities in health and healthcare that have once again been exposed by this COVID-19 public health emergency. And so we are continuing to work with lawmakers to help address this situation as well. So got a lot on our plate. And hopefully by the time we get together for Virtual Vital, we will have good news to share in all of the policy areas that I just mentioned here in this quick update.
Carlos, it does sound like you have a lot on a plate, but also that perhaps you're pretty hungry and ready to grow. Thank you for helping succinctly summarize all that's going on and the priorities coming up. I know there's a lot more detail and information that you and Beth have to give us, and we hope that our members will be able to join us on Tuesday, August 18th for a federal, legislative, and regulatory update at Virtual Vital 2020. In order to join that session live on Tuesday, August 18th, simply go to vital.essentialhospitals.org to register. You'll also be able to view this session on demand after it's been recorded. Our final speaker for today is Dr. Kalpana Ramaiah, Vice President of Innovation and Director of Essential Hospitals Institute. Essential hospitals are some of the most innovative and leading the charge on setting best practices for COVID-19 solutions and caring for patients with complex medical and social needs. Dr. Ramaiah, how can members learn from one another about successful approaches to caring for vulnerable patients during the pandemic?
Before I respond to your question, let me convey my thanks to our members. They're the ones in the front line day in and day out serving the vulnerable population, so thank you. And now to answer your question, our members are well known for their innovations, even amidst tight resources, and they're always willing to share their lesson learned with their peers. So there are several ways in which America's Essential Hospitals is here to facilitate this peer-to-peer learning. We continue to provide resources and communications members are already familiar with. Our newsline articles, latest from action updates on policy, action alerts to spur legislative activity, and so on. We have also developed 4 new communication channels specific to COVID-19. The number one is a weekly COVID-19 update with links to policy updates, new resources, members in the news, and upcoming webinars and calls. And these webinars and calls are just not from our association, but from the field too. And if you're not getting these emails, you can go to our website, essentialhospitals.org, and sign up there. And that's where you can download members-only material. And if you still have trouble, do not hesitate to reach out to us. It's membership@essentialhospitals.org, and we can help you fix it. The second communication channel that we have is a webinar series that we have developed for COVID-19. We have facilitated 15 COVID-19 specific webinars, and these are available to our members, both live and on demand. So if you have missed it once, there's always opportunity to go back and listen to them. For example, in May, we highlighted Dr. Vivek Prachand from the University of Chicago Medicine, who developed and applied a medically necessary surgery prioritizing process. In the same month, New York City Health and Hospitals shared their process for recruiting more than 1,600 volunteer providers through public, private, and association partnerships during their surge in case. In addition to the webinars, the speakers shared these materials that they have developed, and that can be used by anyone in our membership to customize your own processes. The third channel is a resource page that can be accessed at our essentialhospitals.org. So once you get to essentialhospitals.org, click the bar in the middle of the page. It's bright red color bar. That click will lead you to the resource page, where you will see federal, state, non-profit, and member policies and tools, and other resources on a number of topics. I could think about 3 on top of my head: financing, care for specific population, and infection control. And you can also submit your research to share with fellow members. It's never too late to submit the research that other members could use. And another way to share information is to reach out through our email list. Sign up for the email list from our resource page, and you can interact within our membership. Essential Hospital staff and individuals from member hospitals have engaged in timely discussions of COVID-19 topics, sharing their knowledge and experience. Actually, even recently, Indiana University Health shared their guidelines for room occupancy, visitor guidelines, and their team member talking points. Those are all documents that they developed, and they have shared this documents and templates for other members to use. So all 4 ways and many ways to reach out to us and for us to help you to have a peer-to-peer learning experience.
Thank you so much, Kalpana. That's a lot of resources, but you helped us understand where we can go to get access to them. During Vital 2020, we'll have even more member-driven resources and best practices being highlighted. Hopefully, you'll be able to join us on Wednesday, August 12th, where members Stanford University and Harris Health System will share how they leverage interdisciplinary teams, directed outreach to high-risk patients, and optimized care pathways to reduce avoidable hospital utilization and readmissions. On Thursday, August 20th, Erie County Medical Center will share how they're leveraging technology for patient safety. And we are particularly excited to announce the winners of the 2020 Gauge Award in Quality and in Population Health. Those folks will be announced on Wednesday, August 19th, and we'll hope you'll join us at 12 p.m. to hear and celebrate those winners.
I hope this session has provided you a check-in on COVID-19, help understand where we are and what's next. Thank you to Bruce, Beth, Carlos, and Kalpana for giving us insights into what's going on within the association, across the country, and within our members. We hope you'll be able to join us August 11th to 13th and 18th to 20th for our Virtual Vital 2020. At that time, there'll be educational sessions for our members and our association staff to share more with you about what's going on in their hospitals. You can join by going to vital.essentialhospitals.org.